This slide is going to discuss stratified squamous epithelium. What we see here is the esophagus. So this is the apical surface, and down here is the basal surface. And we can already see with the 4x objective that we have multiple layers of cells. So always on the epithelial tissue, you're going to look to the empty space, and that will be your apical surface. If we move the 10x objective into place, we can see this is the connective tissue of the basal surface. So here's the very basal layer. This is the apical layer. And this tissue would be in your esophagus. And the reason that we need to have a stratified tissue in the esophagus is that the esophagus needs to be able to withstand a little bit of friction, a little bit of abuse. We can take a bite of a potato chip or a crunchy candy and it does not scratch deeply if we have friction on the way down to the stomach. So here we have kind of round shaped cells at the basal level. The basal layer here, you can see these round nuclei, but we name this tissue based on the shape of the cells at the apical surface. So these cells have a very flattened nucleus, so these are stratified squamous epithelium. If we look at the histology guide website, if we click on this, it'll take us to the histology guide website where we can again adjust the level of magnification. We can move the image around, and notice on the basal side we have beautiful kind of cuboidal cells at the basal side, but at the apical side these cells flatten out and become very squamous in their shape. Look at these beautiful squamous cells, and this is of the esophagus, I believe. So these are squamous cells at the apical surface. So this is stratified squamous epithelium.